As COVID infections rise but testing declines, scientists in Wisconsin are looking for new ways to track the presence of the virus in our community.
The latest tool in their arsenal, wastewater. How do they do it? Susan Simon shows us.
With more of us testing for COVID at home, it's become more difficult to monitor infection rates. That's why wastewater sampling is more valuable than ever, using sewage to track the trends. You are listening to the sound of the new COVID test. What we flush down the drain could hold clues to the next surge of COVID-19.
Wastewater actually tells us a really great story.
Every day, 36 million gallons of wastewater flow through the Madison Metropolitan Sewerage District. It's something most people want to avoid, but scientists see a public health goldmine.
What we've learned is that with viruses, people shed the virus, right? And when they use the bathroom, and then that enters the wastewater stream.
The virus is shed even when people have no symptoms.
So we're looking which way the channel's flowing.
Ray Schneider is a collection systems supervisor with the Madison Sewerage District. Twice a week, he leads a team underground to collect sewage samples across the area.
This here is a torpedo tube. This has got different type of material in here that absorbs the sewage. And we put this screen around that to protect the solids and debris from getting around there so it doesn't cover it.
Okay.
So it gets a good representative sample.
The torpedo is attached to a rope and dropped 15 feet into the sewage below, where it will absorb information for 24 hours.
It's a very unbiased and objective way to measure the amount of a given pathogen in the community.
Senior scientist Martin Schaefer leads the team at the State Lab of Hygiene in Madison. Scientists isolate and concentrate the viral particles, then extract and quantify the genetic material.
It's a tool that allows us to amplify a certain segment of a gene. We're not looking for an intact virus as such. We're looking for the genetics material from a given virus.
In 2020, Schaefer and his colleagues started testing wastewater at 70 facilities across the state. The Wisconsin program was one of just 6 that formed the National Wastewater Surveillance System.
Almost everyone is aware of wastewater. It struck a chord.
Schaefer now has more than 2 years of data showing how closely COVID cases in Dane County correlated with virus levels in the wastewater.
You know, for a year and a half or two, they mirrored each other almost exactly.
Wow.
And then as home testing and point of care testing took off, there's this huge divergence between, you know, the clinical testing is down here, and now the wastewater testing is reflecting what's really in the community.
Scientists can't pinpoint who is infected and who isn't. It's a tool to show what's happening in a community rather than relying on those who can get tested.
Sewage is the mirror of society, and I think that's very true. And so you can say a lot about the community by looking at their sewage.
A canary in the coal mine to predict future dangers the pandemic may have in store. The State Lab of Hygiene's wastewater data is available on a dashboard online. We have a link at channel3000.com.